Welcome to the fascinating journey of psychopharmacology. Our story begins in the early 20th century when the first antipsychotic drugs were accidentally discovered. These initial breakthroughs paved the way for the development of medications that could alter brain chemistry, offering new hope for those suffering from mental illnesses. As we move forward, we encounter the 1950s, a decade often referred to as the golden age of psychopharmacology. During this time, the introduction of antidepressants and anxiolytics revolutionized the treatment of mood disorders. The journey continues into the late 20th and early 21st centuries, where advances in neuroscience and technology have allowed for more targeted and effective treatments. From selective serotonin reuptake inhibitors to the latest developments in personalized medicine, the field of psychopharmacology continues to evolve, offering new possibilities for mental health care. Our genetic makeup plays a pivotal role in how we respond to medications. This field, known as pharmacogenomics, investigates how our genes affect our reaction to drugs. One of the key areas of interest is the cytochrome P450 enzyme system. These enzymes are responsible for the metabolism of many drugs. Genetic variations can lead to differences in enzyme activity, categorizing individuals as poor, intermediate, extensive, or ultra-rapid metabolizers. This means that a standard dose of medication might be too high for some, causing adverse effects, or too low for others, rendering it ineffective. For instance, variations in the CYP2D6 gene can significantly impact the metabolism of antidepressants and antipsychotics. Poor metabolizers might experience increased side effects, while ultra-rapid metabolizers may require higher doses to achieve therapeutic effects. Another important gene is the SLC6A4 gene, which encodes the serotonin transporter. Variants of this gene can influence the effectiveness of SSRIs. Individuals with certain variants may respond better to these medications, while others might need alternative treatments. Pharmacogenomic testing is becoming more accessible, allowing healthcare providers to use genetic information to guide medication choices. As we journey deeper, let's address the ethical considerations associated with the use of psychotropic medications. One of the primary ethical concerns is the balance between benefits and risks. Psychotropic medications can alleviate symptoms of mental health disorders, allowing individuals to lead more fulfilling lives. However, these benefits must be weighed against potential side effects, which can sometimes be severe and impact physical health. It's important to ensure that patients are fully informed about both the positive and negative aspects of their treatment options. Another ethical issue is the question of informed consent. Patients must have the autonomy to make decisions about their treatment, which means they need to understand the nature of their condition, the proposed medications, and any alternative treatments. This is particularly challenging when dealing with vulnerable populations, such as those with severe mental illness or cognitive impairments. The potential for over-medication is another concern. There's also the issue of access and equity. Socioeconomic factors, geographic location, and healthcare infrastructure can all influence whether individuals receive the treatment they need. Ensuring equitable access to psychopharmacological treatments is an ethical imperative. Lastly, we must consider the long-term implications of psychotropic medication use, particularly in children and adolescents. The developing brain is sensitive to chemical interventions, and the long-term effects of these medications are not always fully understood. Careful consideration and monitoring are essential to safeguard the well-being of young patients. In conclusion, while psychopharmacology holds immense promise for treating mental health disorders, it's essential to navigate these ethical considerations with care and compassion. Next stop in this fascinating world of psychopharmacology is the controversial monoamine hypothesis. First, let's set the stage with some historical context. The monoamine hypothesis, which emerged in the mid-20th century, proposes that mood disorders are linked to imbalances in monoamines, dopamine, serotonin, and norepinephrine. These neurotransmitters play crucial roles in mood, cognition, and behavior. Now let's talk about schizophrenia. The dopamine hypothesis suggests that overactivity of dopamine in the mesolimbic pathways contributes to positive symptoms like hallucinations. Conversely, dopamine hypoactivity in the mesocortical pathways is linked to negative symptoms such as flat affect. But that's not all. Glutamate NMDA receptor dysfunction also plays a role in schizophrenia. To address these imbalances, typical and atypical antipsychotics, primarily D2 receptor antagonists, are used. Emerging treatments are exploring glutamatergic modulators. Shifting gears to depression, the monoamine hypothesis here points to deficiencies in serotonin, norepinephrine, and dopamine as culprits. These imbalances can lead to depressive symptoms. Medications like SSRIs and SNRIs help increase serotonin and norepinephrine levels, while MAOIs affect monoamine metabolism to alleviate symptoms. Next up is ADHD, where dopamine and norepinephrine hypoactivity in the prefrontal cortex impairs executive functioning and attention. Stimulants like methylphenidate and amphetamines boost the release of these neurotransmitters, improving focus. Non-stimulants such as atomoxetine and newer formulas such as viloxazine also play a role in managing ADHD. When it comes to bipolar disorder, neurotransmitter dysregulation during manic and depressive phases is considered. Dopamine dysregulation drives mania, while serotonin helps stabilize mood. Mood stabilizers like lithium, along with atypical antipsychotics targeting dopamine and serotonin receptors, are commonly used treatments. Anxiety disorders often involve serotonin and GABA dysfunction. SSRIs and SNRIs are used for long-term treatment. For acute relief, benzodiazepines act on GABA-A receptors, while beta blockers manage physiological symptoms like tachycardia and other adrenergic responses. Dopamine receptors are targeted by antipsychotics, serotonin receptors by antidepressants, and GABA receptors by anxiolytics. Glutamate, acetylcholine, adrenergic, and orexin receptors are also emerging targets for novel treatments. We're moving towards therapies targeting multiple neurotransmitter systems and personalized medicine. Emerging research on psychedelics like ketamine and psilocybin is also exploring new avenues for neuroplasticity and mental health treatment. Psychopharmacology has made tremendous strides in treating mental health conditions, but with the benefits of psychotropic medications come challenges, including side effects. Drug-induced movement disorders such as tardive dyskinesia and akathisia can significantly impact a patient's quality of life. By examining neural pathways and dopamine receptors, researchers are developing targeted therapies to mitigate these side effects. Side effects of psychotropics extend beyond movement disorders. Patients may experience weight gain, metabolic changes, and cognitive effects. GLP-1 receptor agonists are emerging as a promising option for managing metabolic side effects. These medications help regulate blood sugar levels and support weight loss, offering relief to patients experiencing weight gain and metabolic changes due to psychotropic medications. GLP-1 receptor agonists also have anti-inflammatory properties, which can reduce brain inflammation. Chronic inflammation is linked to psychiatric disorders such as depression and anxiety. By lowering inflammation, GLP-1 medications may help improve mental health outcomes. Innovations in psychopharmacology continue to emerge. Novel medications with improved safety profiles and fewer side effects are on the horizon, offering hope for better treatment outcomes. Emerging treatments and groundbreaking technologies promise to revolutionize mental health care in ways we are only beginning to imagine. One of the most exciting developments is the rise of personalized medicine. Advances in genomics and pharmacogenomics are enabling us to tailor treatments to individual patients based on their genetic profiles. Another promising area is the use of digital therapeutics and artificial intelligence. Virtual reality and AI-powered therapy are revolutionizing the way we approach mental health. Patients can now access real-time support and immersive therapy sessions from the comfort of their homes. These technologies can also provide real-time monitoring and support, allowing for more proactive and responsive mental health care. Neurotechnology is unlocking the mysteries of the brain. Through brain-computer interfaces, we can monitor and regulate neural activity, offering new hope for conditions like depression, anxiety, and PTSD. Neurostimulation techniques such as transcranial magnetic stimulation, TMS, and deep brain stimulation, DBS, are also gaining traction. These non-invasive or minimally invasive methods target specific brain regions to modulate neural activity, offering new hope for patients with treatment-resistant conditions like depression and OCD. The resurgence of interest in psychedelic-assisted therapy is another fascinating frontier. Substances like psilocybin, MDMA, and ketamine are being studied for their potential to induce profound therapeutic experiences and promote neuroplasticity. Early research shows promising results for conditions such as PTSD, depression, and anxiety, suggesting that these once stigmatized substances could become valuable tools in our therapeutic arsenal. Additionally, advancements in neuroimaging and biomarker research are enhancing our understanding of mental health disorders at a biological level. These tools allow for more accurate diagnoses and can guide the development of targeted treatments, moving us closer to precision psychiatry. As we stand on the cusp of these innovations, it's clear that the future of psychopharmacology holds immense potential. By embracing these emerging treatments and technologies, we can transform mental health care, offering more effective, personalized, and holistic approaches to those in need. Follow us for more psych education, and for CE credits, visit our website at www.advancedpractice.io.